Health Minister Dr. Joe Phaahla, together with his counterparts from Brazil, Russia, India and China, will be adopting the declaration of the 13th BRICS Health Ministers Meeting in Durban this morning. They'll be outlining the resolutions of the four-day discussions, which include the establishment of BRICS Nuclear Medicine to prevent and reduce deaths from oncology diseases and to improve palliative care. There's also the creation of the BRICS TB Research Network to reduce the burden on member states, which account for 40% of the world's TB burden. For more on this, we're joined this morning by Health Minister Dr. Joe Phaahla. It's great to see you. Thanks very much indeed for coming on. When we talk about the important issues facing the healthcare sector in BRICS member states, of course, we're focused on South Africa here at home. There are many, many issues to choose from.
Well, thank you very much, Michelle. Good morning to the viewers of Newzroom Afrika. Indeed, there are a number of issues. Of course, we are very grateful that we are now able to meet in person. That's after 3 years of virtual meetings of the health ministers of BRICS. And as you know, this is in preparation in the forerun to the Heads of State Summit happening later this year. So, of course, the issues which you have mentioned are some of those. Of course, we also, just emerging from the COVID-19, will be looking also at, strengthening our early warning systems in the prevention of infectious disease, making sure that we can strengthen our surveillance information sharing, our laboratory capacity, also including our genomic surveillance, because we believe, as our scientists have been warning us, that this is not the last pandemic. We must be ready for more. But we also know that there are many other risks which have threatened our health systems, some of which multiple emergencies, not only in terms of infectious diseases such as cholera, but also things like floods and other emergencies like drought and shortage of water affects, as you know, currently as we are meeting here, our counterparts in China are going through serious floods in Beijing and other cities. So these are some of the issues which we'll be looking at. But overall also, the whole idea of a universal health coverage, there are matters which we need to share experiences, access to affordable medicines, diagnostics, including also digital health systems, which will assist all of us if we share all the experiences to make sure that our countries can be safe and our people can be able to receive affordable health services. Yeah.
Before we get to the issue of universal health coverage, Dr. Phaahla, I want to talk to you more about, the fact that this is not the last pandemic that we faced in the form of COVID-19. And I know we've learned many, many lessons from COVID-19. If we just cast our minds back a couple of years to when the vaccine was still in production, there were fears that South Africa, other BRICS member states as well, would be left out of the cold insofar as getting the vaccine as soon as possible. Are these the kinds of issues as well that will be addressed in the final day of these discussions today?
Well, definitely, as you indicated in your intro, that this is actually the last day. So our senior officials have been discussing, working on all the various areas in terms of when we talk about pandemic preparedness, prevention and response. The issue of sharing technologies in as far as vaccine production is quite top on the table. You would know that amongst the 5 countries, China was quite advanced in production of vaccines, Russia also, and of course ourselves here at home, thanks to the support also of the World Health Organization. We do have a center which has been established in Cape Town for transfer of the messenger RNA technology of vaccine production. So this is also a very strong area on which we will be elaborating this morning in terms of how the 5 countries are going to be cooperating in making sure that for future risks we can share all the technology for vaccine production, including, I must add, also tuberculosis, TB. We're also looking at sharing information of our scientists in as far as vaccine for effective vaccination for TB is concerned.
So, Minister, when we talk about universal health care by 2030, that's not a long way away, 7 years away, and we know the incredible amount of work that we need to do insofar as our own NHI is concerned before we can even talk about universal health care. So how does cooperation between BRICS member states help us work towards that 2030 deadline?
Now, we're talking here of countries, all of them, all the other four, with huge populations. I mean, just the five, South Africa in terms of population size is the smallest. We're talking about the two with over 1 billion population, China and India, and even Brazil also quite a big population, close to 230,000, and Russia just over 140. Brazil 230 million, and Russia just over 140 million people. So what we are looking at here is sharing experience in as far as the systems of health delivery services in these countries, looking at also exchange of experience in as far as rolling out access to health services. The systems will be different, as the political systems are also different, but there is something in common in as far as, the tools, access to affordable medicines, access to medical technology, including health information systems, just the record systems, making sure that, as I say, in these huge populations, we are agreeing amongst others to exchange experiences in as far as digital systems of record systems, which is very key in as far as rolling out universal access to health services. But also, amongst other things which we are looking at modalities, is the exchange of experts in as far as your doctors, your specialists, and various other health professionals amongst these four countries, so that you can be able to learn from each other as we are all committing to universal health coverage.
So we've talked about COVID-19, we've talked about the issue of universal health coverage. TB is also going to be high up on your agenda, Minister. It's such an important story here at home. We saw a number of issues arising again from the COVID-19 pandemic, but even in 2023, TB is still the leading cause of death in our country.
Definitely. As you said already, 40% of the world burden of tuberculosis is in these 5 countries. But of course, as South Africa, we are top in terms of that, especially with the co-infection between HIV and TB. But we're all committing to, again, in the area of TB, better sharing of research information, improvement in the diagnostics. There's been a lot of advances in this area, but India, for instance, is quite advanced in some of the more rapid diagnosis of TB, and then also improvement in the quality of treatment. We know that part of the problem, TB is curable, but part of the reason why we don't have a very high cure rate, we're still standing below 80% of cure rate for people who are infected with tuberculosis on treatment for TB sensitive, which is still sensitive to the TB drugs. So we're working together in improving the kind of treatment which can even be shorter than the 6 months for TB for drug sensitive, and also 9 months for.
Dr. Joe Phaahla, let me thank you for your time this morning. Really a monumental declaration being signed by health ministers in Durban today, including yourself, Dr. Phaahla. Let's hope that it translates into addressing some of the challenges that we're facing here at home. Dr. Joe Phaahla is our health minister.